In today's video, I'm going to be talking about diabetes. I've been meaning to make this video for quite a while, and honestly I just kept putting it off because if I was saying, oh hey, I've got time to make a video today, there was always something coming up that was more time sensitive. So like, I wanted to make it before Easter, but then I was like, oh, I should probably make an Easter related video. Or I'd be saying, oh, I'm going to make it now, but it's nearly Halloween, so I'm going to make one about fireworks and so on and so forth. I've just been putting it off and I don't know why. So finally, here's a video on diabetes mellitus. Diabetes mellitus, or just diabetes as it's more commonly known, is a condition that occurs when the body cannot use glucose normally. So glucose is a form of sugar that we have inside our body that the body uses for energy for the cells to do what they need to do. So the levels of glucose in the blood are usually controlled by a hormone called insulin, and that's made by your pancreas. We do not know what exactly causes diabetes, like in humans or dogs or cats or anything, but we do know that it's caused because the pancreas is either incapable of making enough insulin for the body, or the body is incapable of using insulin in the correct way. So, for example, if you were in an accident and your pancreas was damaged, you may become diabetic after that because your pancreas is no longer able to make the insulin that you need. So we're not 100% sure what causes diabetes, as in there's not a single cause that makes it happen, but we do know that it's just because there isn't insulin being used correctly in the body. Insulin is required to send the glucose from the bloodstream into the cells. So if there's not enough insulin in the body, or the body's unable to use the insulin, the glucose kind of builds up into high levels in the blood and causes a condition called hyperglycemia. So when the blood glucose reaches this level, the glucose kind of overflows and you have to excrete it in your urine, and it draws large volumes of water with it, which is why one of the main signs and symptoms that you will see with diabetic people and pets is an increased amount of thirst, like an ungodly amount of, I need to constantly drink water. You're constantly thirsty, you're constantly dehydrated because your body is taking all this water in to try dilute down this glucose so you can excrete it in a safe way. Regardless of what type of sugar you're taking in or the amount of sugar in the blood, there isn't enough glucose being transported into the cells, and because the glucose is used for energy and for the cells to function, they cannot function normally. So then the tissues become starved for energy. So this can cause the body to kind of break down fat and muscle tissue, which then is broken into sugar and used, which is why, again, another symptom that you would see a lot is weight loss, because the body is just trying to survive, it's trying to get the energy it needs, but unfortunately the only way that it is capable of processing any energy at that time is by taking what you already have, which is your fat and your muscle, but you kind of need those. So that's why you'll see weight loss, you'll see people becoming a lot more delicate. You can especially see, like, if you've ever seen an elderly person that's diabetic, like, you'll see they're pretty frail looking, and when they're not treated properly, or if they're just being diagnosed, and that's why that happens. Diabetes in dogs and cats can occur at any age. Most diabetic dogs would be diagnosed between 7 and 10 years of age usually, and most diabetic cats are older than 6. So diabetes can occur in female dogs twice as often as male dogs, and certain breeds of dog are disposed to diabetes, including Labradors, and Beauty, my dog, who is diabetic, is a lab mixed with a border collie. So she's diabetic, and she's half of the breed that is predisposed to diabetes. Obesity is also a significant risk factor when it comes to developing diabetes in the first place, and I don't know how many people are aware of this, but Beauty, when I got her, was nearly 40 kg, and she is currently at this time about 17 and a half, 18 kg, so she was way heavier than she should have been. Now, ideally, I want her to be around 20, so I am trying to build her up a bit, because her diabetes actually acted up fairly recently. For whatever reason, it kind of got worse, or whatever the story was, so myself and the vets have been trying to adjust the amount of insulin that she's been getting, and we're changing up her food and stuff, because she lost quite a bit of weight. And I'll attach pictures here. but she lost quite a bit of weight, and we were pretty concerned. But she's better now. She's better than she was, and she's acting the way she should, and she's not been chugging water recently and so forth. So she is improving, but it is a thing that you just have to continuously be going to vets and working with vets on, because it can change over time. So like their diet, their activity level, so on and so forth, will greatly affect how much sugars they need and how much they're actually using, and so on and so forth. So it's just something you have to keep on top of, and it's not a here's a cure, that's it, you're done, fixed, everything's grand, just do this. It is something you have to keep on top of. So, what are the signs and symptoms of diabetes? So, just first off, for those who don't know, signs are what you can see, symptoms is what is happening. So, a sign would be, say, for example, increased thirst. So you can see that they are wanting to drink anything, whereas a symptom would be dehydration, which is why they are looking for the increased thirst. So signs and symptoms include excessive thirst, increased urination, because obviously they're taking in all that water, they're trying to get rid of all that sugar they don't need, weight loss despite normal or increased appetite. So their appetite can go up quite a bit, or it can go down because they're just not feeling well in themselves. They don't have the energy to be doing what they want. And obviously the weight loss, because like I mentioned, it'll use up the muscle and the fat. And some more advanced signs can include sudden onset blindness, so their eyes can be affected by this due to cataracts forming, loss of appetite, lack of energy, lethargy, which is basically lack of energy, and vomiting. So with Beauty, what happened was that she was an indoor dog, like an indoor-outdoor, like she was free to come and go. She lived on a farm. And what happened was she was chugging water all the time, she was peeing herself inside, and her owners, I was in contact with them, and I was saying to them that honestly I thought it could be diabetes, just because I studied animal science in school and I was aware of it. So I said to them, I think it could be diabetes. So she went to a vet. They did a blood glucose test, which is where they take a small drop of blood and they test how much sugar is in it. And she was way above what she should have been. Like, it was immensely so high up there. So they said, yeah, no, she's very, very, very likely to be diabetic. We're going to give her like a week on this specific food. Don't give her anything else other than this specific low carb, high protein food. And we'll see what the story is. And after a week, she was still really high up there. So they're like, right, grand, we're going to have to put her on insulin. So insulin, or caninsulin, which is canine insulin, is a manufactured thing. It isn't a naturally occurring thing. So we don't have dogs out there that we're just taking insulin from to give to other dogs. We have them they're made in a lab, they're bottled up, and you take them home, you keep them in your fridge, and you give them a small amount of insulin per day depending on what they need. So as of right now, it is the 9th of May 2023, Beauty is on 11 units of insulin per meal. So she gets her breakfast in the morning, I wait 30 minutes, and then I give her 11 units of insulin. So she's very good for it. She doesn't mind it at all. So that's how we keep hers under control. In the past, she used to be on 4 units of insulin twice a day, which was when she was doing really well, whereas recently it's had to go up. When I first got her, I think she was on 15 or 16 units of insulin. So like, it was quite a bit. So a unit is just whatever way they decide to measure it. It's just so that we know what it is for medical purposes. The syringes have units on them. There's 40 units of insulin in 1 milliliter of the caninsulin that I use. Obviously this may vary, but yeah, so basically we got her, we gave her the insulin and so forth. Her owners were not in a position to deal with this, both financially and physically, to keep her, because she was fairly skittish when I first got her, because she was a farm dog. She liked being on the farm. She was happy to run around the place and do her thing. She wasn't all that used to being restrained and stabbed daily, so she was a mild danger in that aspect, a bite risk, because she wasn't used to it. She was scared. So I took her, and she's been mine ever since. I've had her about 3 years now or so, roughly. So in that time, she has gotten way better. When I open the fridge in the morning, about half an hour after her food, she just knows. She'll come over, she'll sit down, I inject her, it's all good. I've made a video in the past on how to inject a dog for diabetes for insulin. And that was when she was very iffy about it. So there's a lot of restraining and holding and moving quickly. Whereas now I'll probably do a new video after this one, showing how I do it now, because it's so much easier and it's pain free for everyone involved, and just she has really improved in that aspect. To keep on top of her diabetes, we do regular vet visits throughout the year, so every 2 to 3 weeks if she's not doing well at the time. Otherwise, it'd be once every month or two. And so I'll bring her to the vet and they'll do a glucose test, which is where they'll just take a small drop of blood from her ear and they will see how much glucose is actually in it. And they can then just keep that on file. And if it's really high, they might want to then do a glucose curve test, which is where they take a small amount of your pet's sugar every few hours over a day to help determine the amount of insulin that they're lacking and they may need replaced. So when I first got her, again, she was fairly nervous, so I did her blood glucose curve. So I took a little prick of her ear every hour for about 16 hours, I think it did, for the first one, just to make sure it was a proper full test. I know usually it's just every 12 or maybe during the day just every second hour or so, whereas we needed to get on top of this because she was so her blood sugars were so high up there that we wanted to make sure that we could fix it. So I did it every single hour. I took a little prick from her ear. She was grand, no problem. And then I brought that to my vet and they were able to see where she'd gone up, where she'd gone down, versus what the expected amount, because usually you would have their bloods would go up a little bit after their breakfast because they would start to absorb their food, and then it goes down in the middle of the day and then it'll start peaking up again. So it's there's an expected curve, whereas she was not following that at all. She was just continuously high and then just going higher up, and then it would suddenly rapidly drop. So these were all not good. So the vet was able to look at this and decide, right, she needs this much insulin, so on and so forth, and we did that, and it was going very well for her. Whereas in more recent times, for some reason, whatever it is, it's probably because she's getting a little bit older, she's kind of slowing down, she's not exercising as much, so she's not using the sugars, so they're just kind of sitting there. So we're just changing it up a bit now, so we've changed it to 11 units twice a day now, and she's due to go back into the vet in about a week or two. So when she goes in, we'll be able to check her blood glucose again, see what we want to do. Another option that vets can do is fructosamine. So fructosamine is a thing that they have where it kind of gives you the average of their sugars over the past 2 weeks. So with this, if I go in for a fructosamine, they will take a blood sample, they send it off to the lab, and then they can get back to me and say, right, in general, or as an average, she's got very high sugar, or she's got very low sugar, or she seems to be roughly around where we want her to be. So we do that as well. I kind of get her to have that done every 2 months or so, just to make sure that we're on track. And aside from that, she's got special food and such. So keeping a diabetic dog can be expensive. It can be a little bit stressful. But when you're on top of it and it's all going well, then it's all good. Genuinely, it's not that big a deal per se. As I said, the main treatment for regulating their blood glucose is giving them insulin injections. So dogs with diabetes typically require 2 per day, so after their breakfast and after their dinner, whereas some dogs will only get once a day if they're only fed once a day, and so on and so forth. Whereas for diabetes, it's just better to do it twice, so it's spread out throughout the day, rather than having just one big spike of insulin and then nothing for the rest of the day. So they cannot really be skipping insulin. Like if they skipped it once or twice by mistake, or if something happened, like they got out or they ran away for a day or so, like it wouldn't kill them, but it would really badly impact them. Like they should have it every single day. It's very much a routine, it's very set, and it should be pretty much set in stone. So because of this, if you ever want to go out of town, if you want to go on vacation, you need to find someone who's able and willing to take your dog and give them these injections each day. So it's the one reason why I'm able to inject Beauty, my mother's able to inject Beauty. I can show other people how, but the first few times you're going to be nervous about it. You're stabbing an animal. Like, it can be a big deal for people who've never injected an animal before. So I would rather leave Beauty with family who I know I have shown multiple times how to do this, rather than a kennel or a daycare and so on and so forth, because it's not that I don't trust them. I just would be more comfortable and happier with the knowledge that it's someone that I can then just call up at whatever hour, or they can call me and they'll be comfortable to tell me that they don't know what they're doing, rather than someone who has done it before but might not be good with beauty specifically, and so on and so forth. So if you have a diabetic animal, you do need to find someone who is willing and capable of taking care of them for you when you're not there, because it's just really important to have them on this very strict routine. Because because diabetes is resulting from when they don't have enough insulin and you can just give them injections, it's typically a fairly easily managed thing. Like it's not something that is terribly difficult. It's very easy to deal with. You just need to practice, and the dog gets into a routine very quickly. So you inject them twice a day or so, just underneath the skin, so subcutaneous, meaning under skin. And usually you inject them around their neck or just between their shoulder blades, where there are very few nerve endings and also a lot of loose skin for you to be able to kind of pinch it up to get under there. And the needle that's used to deliver the insulin is really fine and really thin, so along with its placement near the shoulder blades and neck where there's fewer nerves, the injections very rarely bother them. It's more just the idea of, oh no, I'm being like held somewhere and stuff. And once they're used to it, there's no problem whatsoever. They also may require a specially formulated prescription food, or something that requires, say, a specific amount of carbs or protein, so that they can kind of predict and control when blood sugar is going to be up and down. And then after each meal, they get their injection to deal with the glucose rise that's going up with that. Because of the fact that extra snacks and treats and such can also cause their sugar to go up, they must be kept on a fairly strict diet, so either no treats at all, or their food has to be reduced when the treats are going up, and so on and so forth. Like, it is very strict. So, like, I live in an apartment. I share my apartment with a student, and the number one rule when the student came in, I was like, you cannot feed my dog. Like, if something drops, you pick it up. Like, there's no feeding her, because I need to know what she has eaten, so that I can then make sure that I'm not going to then be overfeeding her something. Because if their sugars go too high, obviously this is super dangerous for them. It's really, really bad. If they go too low, they can have a seizure. And Beauty has had a seizure before. At least one that I'm aware of anyway. And it's from when the glucose drops way too low, and then when they've had a seizure, it drops further. So you have to like feed them, you have to try help them recover afterwards. And all of that would be avoidable as long as I'm fully aware of what she's eating and when, and I'm able to give her insulin, and I'm just aware of what her situation is. So there are possible complications from when you're treating a diabetic dog, and these are things that are like very rarely go wrong, but it's just stuff that people would worry about. So like, what if you accidentally inject too much or too little insulin? What if the needle doesn't go in the skin properly and you actually squirt out the insulin by mistake on the dog rather than inside the skin? What if your insulin goes off because you've left it out of the fridge for too long and it hasn't been kept cold, or like your electricity goes out or the fridge breaks, so on and so forth? What about if the dog didn't eat all their food, or what if they stole some of the other dog's food as well, so then they've eaten extra food? Or what if they've gotten sick after they've eaten, meaning they haven't absorbed the food the way they should have? If any of these things happen, it's a pretty easy fix. You call your vet and they will tell you what to do, because it's very individual specific. So I know at one point Beauty did get sick after she'd ate, but I'd already injected her. And I was worried. I was like, well, have I dosed her up to bring her sugars down? But she hasn't absorbed any sugars. Therefore, she's going to be in trouble with that her sugar's going to dip down really, really far. And the vet, I rang them and they were like, no, you're all good, because of the fact that she'd eaten it for this amount of time. She has absorbed some. Just give her some chicken or something like that now that she will eat even if she's feeling unwell, because it's tasty and it'll all even out and it'll be fine. So that's what they told me to do for Beauty. Whereas for another dog, they might be like, oh yeah, this is very serious, bring them in. For someone else, they might be like, yeah, give them something high in sugar because that's dangerous because of the amount they had. For other dogs, if they're on 1 unit of insulin, maybe they'll be like, nah, it's okay, just keep an eye and make sure they don't start feeling unwell. So it is very individual specific, and you just need to be aware of that it's not a one-size-fits-all situation. If your dog has too little sugar, it's called hypoglycemia, and if they have too much, it's called hyperglycemia. So think of hyper as in like a kid has had too much sugar, they're bouncing around the place, they're hyper. So hyper is high and hypo is low. So if your dog becomes hypoglycemic, then sometimes you will need to give them something to boost their sugar quickly. So if they become hypoglycemic, they tend to start vomiting, they become wobbly and spaced out, they seem really hungry, but sometimes they're just incapable of eating, they're twitchy, they can collapse, they can have a seizure. So if your dog is having any of these symptoms, they need to be given sugar really quickly. So it's a good idea to carry like a small sachet of something sugary everywhere you go, like liquid glucose sachets that are designed for people running marathons, or jam or honey or stuff like that that's really high in sugars. And what you do is you rub a little bit on their gums. Now if they're having a seizure, don't put your hand anywhere near that mouth. They are not capable, they are not aware, they will bite your finger off, and I'm not exaggerating. Your finger will be gone and they will not stop. Like they're not aware of it. So if they're in the middle of a seizure, pour it on their face. If it can get in their mouth, fantastic. If not, you wait until their seizure is done, immediately rub it onto their gums, put a little bit in their mouth, see if they can swallow it, and ring your vet. That would be your go-to emergency first aid for that situation. So just as a general summary, diabetes mellitus is easy to treat once it's been diagnosed. It's pretty easy to diagnose when a vet is looking for it. It happens to dogs that are older a lot of time. It can happen to some dogs, it can happen to others. Some breeds are more disposed to it. It doesn't mean that they're going to get it. It just means that it just so happens that breed it's seen more often in that breed than others. So you cannot particularly prepare for it. You can't get a pup and be like, ah yes, I want a pup specifically that's never going to get this. Sometimes it just happens. But you can be aware of the signs and symptoms of what to look out for, so that if you're concerned that your dog may have developed diabetes or may be like starting to display these signs and symptoms, you can go to a vet and say, hey, listen, could you do a glucose test? Because they can do it very quickly just on the spot. It's just a prick of the ear and they're done. A prick of the ear, or if they're taking blood already, they'll just take a little bit of that blood that they used for the test to put on the little paper with the glucometer to see what the story is. So it's not an unheard of disease, it's not rare, it's not uncommon. So if your dog does develop it and you find that you are not in a situation to deal with that, that's okay. There's so many places that can. If you find that, oh, well, you've gotten a dog, so on and so forth, but the dog is a little bit snappy or so on and so forth, they're living a great life with you, but if you were going to have to every day inject them and you've got, say, you're on blood thinners, if that dog bites you, even if it's just because they were spooked and stuff, if that dog bites you, you could be in serious danger. So don't put yourself in that position. It's not a case of it's not like rabies or something where it's going to be a terminal thing that's going to be a big issue. No, diabetes is just something that they can live with. They will have it for the rest of their lives. It's not a curable thing. It's not going to go away. You can't change up their life to the point that it's no longer there, but you can improve their diet and their exercise and give them insulin to the point that it's basically as if there's nothing happening. Like, it's not going to be a big deal for them. It does not impact them in any other way, as long as it's actually just taken care of and they're on a routine. So if you're doing it, if you're taking in a dog that's diabetic, or if your current dog becomes diabetic, if you're able to deal with it, no problem. If you can't, no problem. Just be aware that there are plenty of shelters and rescues and people out there that are more than well equipped to deal with a dog that has this. And so if yours does, if for whatever reason you believe that you are not capable of giving this dog the life it deserves, or you're not comfortable with the idea of injecting an animal, so on and so forth, don't put it off, don't ignore it. There's no shame in it. If you think that the dog will be better off elsewhere, do it. It's all good. There's no downside. The dog is not going to be put to sleep in the shelter because it's diabetic. Lots of people will take in a diabetic dog. It's an easy thing to deal with. A lot of diabetic people take in diabetic dogs because in the mornings they'll test their bloods, they'll test the dog's bloods, and they'll do it together. It's their routine together. So don't be worried that it's a thing of you'll hand in the dog, they'll be saying, oh yeah, no, we'll take care of Fluffy, and then they put him down. That's not the case. They will take care of the dog as best as they can, and it's a very easy and simple thing to help the dog with. I cannot stress enough how many people see that their dog is diabetic. They're like, oh, we're going to have to put him down, so. And I'm like, no, you really don't need to. He'll live a perfectly fine life. He'll be fine. Just give him injections twice a day. That's it. Injections, a walk morning and evening, and his special food. Or even, some of them don't need special food. They just need their insulin. a lot of people they see diabetes and they immediately, their brain just goes to the pessimistic side of, oh, this is the end. And it's really not. It's really, really not. So yeah, just as a summary, it's a lifelong thing. It cannot be cured, but it can be treated. And they can live perfectly happy, healthy lives, doing all the things the other dogs do. No problems whatsoever. There are some things, like Beauty is losing her vision, but like she's walking around the house no problem. She knows where everything is. I just can't move my couch or my bed. Like, that's it. It's just in case she goes leaping up to the couch isn't there, she'll go flying across the room. Wouldn't be fair on her. So it's just stuff like that. So it's just little life changes here and there that do not make an overall massive impact on us, but do for them. So just, yeah, if your dog becomes diabetic, please, for the love of God, talk to a vet. Don't just immediately be like, hey, let's put it down. So yeah, that's it. That's all I can think of for right now. On diabetes, the video went on quite a bit longer than I expected it to, and my throat is so bloody dry right now. But yeah, so I've had Beauty for about 3 years now, roughly, and she's turned 8 a few days ago. And yeah, she seems to be going well. She's building back up the weight that she has lost. So I'll try put in a picture. I'll take a picture of her now, actually, and I'll throw that in at the end here now, so you can see that she is better than she was, and her coat is nice and shiny, and she's doing her thing. She's playing her games. She's got no bothers in the world. So yeah, that's it. If you have any questions relating to diabetes, let me know. Put in the comments below. I'll do my best to help. But I am not a vet, so if you think your dog is diabetic, please go to a vet, not to me. And sure, I'll do my best to help with any questions that are asked. If you have a diabetic dog, tell me about them. Let me know, like, what age were they diagnosed, how long did they live, or are they still alive, and what age they are now. Any good treats and snacks and things, like celery and cucumber and watermelon tends to be like favourable things for dogs at times. Sorry, not watermelon, what am I saying? Celery and like cucumbers and stuff, because they're very, very, very low in sugar. They're mostly just water, but it's something for the dog to crunch on if they're looking for a treat from something. You know, it's like there's so many just slight replacements that you can do that will end up giving this dog a fantastic life, no problems whatsoever. I'm sorry if there's noise in the background. Pickle has decided now is the time to murder the giant caterpillar. And yeah, so yeah, tell me about your diabetic dogs and such, or if you've got diabetic people, go for it. I might as well just make it a whole full species diabetics video. And yeah, that's it. Have a good day. I'm gonna go make some cinnamon rolls.